as surgeons, we're kind of taught that you need to be 24/7 at your job, and most of us did do that for many years. But to be able to step away from it just a little bit to raise a family is huge for me. So I'm very grateful for that.
So I am here live at the Aesthetic Meet with Dr. Azar. Welcome to the podcast.
Thank you so much, Erica. Thanks for having me.
Thank you. Okay, I want to talk about something a little bit different. So you run a successful practice in Thousand Oaks, but you're also a dad, and something that you and I have talked about many times socially is let's talk about life-work balance for you as a plastic surgeon.
Absolutely. It's definitely part of our challenges day in and day out. How do you focus on your job, which is very intense, very focused, very high responsibility, but also raise a great kid? It's definitely a challenge. So like most things, I'm learning as we go, but the biggest thing is obviously setting your priorities straight. Obviously, we're never going to compromise our patient care first and foremost, but whenever you can set aside some time for your kids. And I know my dad was a surgeon also, and he didn't spend that much time with me because he just couldn't. So I find it to be a luxury that I can take a little bit of time. So it's not like when I go into my patient's exam room, I kind of put all my other questions in my mind aside, like Yoda says, like clear your mind of questions,
Yes.
So I kind of use that to help me focus on my patients. And then when nothing's going on with my patients, then I focus on my daughter. So it's sort of a multitasking, but not really sort of serial multitasking, I think.
Yeah, that makes sense. And then do you have like particular OR days versus admin days?
I do. I have typically Mondays and Wednesdays. I like to do surgery. I've spent some of my Wednesdays with my daughter instead and swapped it out for Sundays because my staff is willing to work on Sundays. And if I need an extra OR day, just to accommodate my patients, I have no problem switching a day here and there. And what's really great, I think, as a parent is like if you tell your patients, hey, I need to go pick up my daughter from school, they're really pretty understanding. And same with my staff. If I tell them, look, I'd rather operate Sunday instead of Wednesday because I got to spend time with my daughter, it's a very good excuse in the sense that everybody's very understanding.
Yeah.
So I'm grateful for that.
Yeah, it's amazing. And then you do wonderful facelifts.
Thank you.
It's my understanding that that's part of your focus in your practice is you're not trying to be a volume clinic. You're trying to have the higher ticket facelifts. You're at a higher price point, which is a good thing, right?
Yes.
And so you're not trying to get just, you're not clocking in for like 4 surgeries in a day or
No,
breast dogs in
definitely
a day.
Not at all.
But you're trying to focus on the higher ticket procedures at the right price point. So it's really about quality, not just a huge quantity.
Absolutely. That's been a big goal of mine from the very beginning when I started 23 years ago. I never signed any insurance contracts. I always thought, you know what, if my patients want me to take extra time with them, I will. With our facelifts now, we've incorporated so many new technologies that make it safer and better for the patient. I just picked up a new one here at the meeting today that I'm excited about. And so there's always things you can add in to make it safer, better, overall better result. And it costs money, unfortunately, and so patients have to understand the standard of care, right? Like if you go to a car dealership and you ask for $2,000 off the car doesn't change. It's still the same car, but in our industry, there's a standard of care. So if you want to provide a lot of extra things, it does cost money. But I only provide things that I think are worth it. We're not doing things that are just fluffy or just to do it. You know what I mean?
That makes sense. So you're basically adding value to the procedure.
That's right.
And do you mind me asking, what are some of those things?
Absolutely. So we started, like a lot of plastic surgeons coming around to using, for example, TXA, which is a medication that our orthopedic colleagues started using to prevent bleeding. So we started doing things like that. And then, I pre-treat my patients with medications and, for example, nutritional supplements and things, vitamins and all of that. And we use skincare, professional skincare. I use the ZO line, which I love, to prepare their skin. And then intraoperatively, there's things that we do, for example, to help make things a little bit safer for the patient. So I'm applying a new product called CO2 Lift, which helps increase the oxygen levels to the tissues and helps prevent them from having any skin necrosis and heal faster. Hyperbaric oxygen, we also try to include some of those treatments if we can. So things like that to really make it overall a better experience.
That's amazing. And I love a CO2 lift. It's my favorite go-to after traveling.
Oh,
after
great.
traveling, yeah. Like I'll put it on an airplane.
That's so
just
cool.
because you get dried out when you travel. Right?
Absolutely.
So I just need some of that. I need some of that hydration back in my skin.
Perfect.
That's fantastic. So I love that. So, because I would argue that to some degree you have a better work-life balance than some plastic surgeons. You spend a lot of time with your family, and I mean that in the most beautiful way,
Thank you so
right?
much.
And I think that a big part of that and your success has been the fact that you have niched, and I know you do, of course you do other procedures, but you have become really specialized in facelift,
I
and
have.
you get to charge right for it, and you get to go in, do a really wonderful facelift and call it a day.
Absolutely. It's something that I've been focused on since I was a lot younger, when I was even a student,
Yeah.
watching some of my colleagues before me who were masters, all the little tips and tricks that they learned. I made notes of them. And I do see it as a luxury as a dad to be able to step away sometimes from work. And, surgeons were kind of taught that you need to be 24/7 at your job, and most of us did do that for many years, but to be able to step away from it just a little bit to raise a family is huge for me, so I'm very grateful for that.
Yeah, that's amazing. I also think in today's age, AI is specializing people, meaning
Yes,
that the practice that does everything is not something that AI rewards. AI rewards specialization. So,
that's
to that
true.
degree, have you had people check you out in ChatGPT or Grok or
We
Gemini or these
have,
things?
yes, surprisingly, we've had patients show up and say, oh yeah, ChatGPT told
Hmm.
me to go to you. I actually had my sister look up randomly who did Nicole Kidman's facelift, and she dug a little deeper, asking, for who's really good. And the AI totally independently recommended me to my own sister who lives like in New York and I'm in LA. So that, I thought that was pretty
That is
cool.
amazing. That's
Yeah,
incredible. Yeah, like I said, for people who have specialized, AI really rewards that. And some people are very frustrated by that. Some people go, well, I give great breasts and tummies and I do great facelifts. And that's very true. And nobody's trying to negate that. Nobody's trying to say something's a certain way. It's just a fact that AI specializes right now. It's
that's right.
not, it
I,
just is,
I don't
you
think it's
know?
any different than what we went through with Google 15 years ago, keeping up
Mm.
with all the algorithm changes when Google decided that it wanted to make you be found in a certain way, because you
Yep.
used to be found the 10 years prior just by your name. Now they wanted you to have more credibility. I think it's going to look at different indices, like have you published papers and what are your
Yes.
reviews, and it'll hopefully be a little bit more sophisticated. It could also be susceptible to herd mentality problem, but we'll have to see where it's headed.
Yeah, I think it's a bit of both. I think there will be some of that herd mentality. I just, unfortunately, even on social media, that's been the case. And I do think some of that will be. I think the one biggest plus about AI is that it very much cares about board certification
Oh, that's great.
heavily and being members of places like the Aesthetic Society or ASPS. And it does recognize that. So I do think that it will weed out some non board certified plastic or cosmetic surgeons, even,
That's really important.
and
I
I
love
think that
that.
that will be very good about AI.
And another thing I think I'm hopeful that will be helpful for is when somebody rehashes something that we did 20 years ago with marketing mumbo jumbo, and they try to dust it off and rehash it. It will kind of cut through that and say, hey, this is a procedure that people have tried over the years, and these were the pros and cons that came out. Just like everything in life has a cycle, we
Yes.
see things come and go, and hopefully the AI will help kind of smooth some of that and say, hey, this is not exactly new. Doctors have been doing this for about 20 years, but it comes and goes.
It's so funny. It's, you said everything has a cycle. And somebody was asking me the other day how I felt about real self. And I was laughing in my head because, like, if you asked me about real self a year or two ago, I was very neutral on it. I didn't. It's not like I thought poorly of it, but I didn't think great of it. I just didn't see. I didn't see it as like a super viable marketing channel. But
I
now you
see.
ask me about today, I think Real Self is great because AI pulls from Real Self. Because of AI, I think there was a time when Real Self was really great because Google pulled from it a lot. Then
Interesting.
there was a big Google algorithm change, and then they stopped pulling from Real Self as much,
Oh,
right?
interesting.
And then now here we are with AI, and now they're pulling from Real Self again.
Awesome. No,
And it's
you're teaching me something, because I hadn't had the time to come around and revisit that
yeah,
issue. I am on Real Self, but I haven't revisited how AI is pulling from it.
it
So
is, and now is in a way. So it's the cycle, right? It was relevant, then frankly, it was irrelevant, and now, in my opinion, it's possibly the most relevant it's been in quite some time. So now I'm
interesting.
like, oh yeah, absolutely, you should be on there, putting things on there because AI is going to pull from it.
One of the things I use Real Self for is when I want to introduce a new treatment or a new device to my practice. I do like to go
It's
on there and
fantastic.
see how many patients have given it the thumbs up.
Yeah.
If it has like a 90% plus thumbs up rating, I'm more happy about bringing that device into my office.
Yeah, that's how I feel about Motiva right now. All right, like
Right.
Motiva does such great marketing
Yes.
themselves,
Right.
right? And every client that I've had have added Motiva has gotten more breast docs, right? And I'm not even saying it's the best breast implant, although it's fantastic. I'm not even arguing that. I'm just saying I'm only talking from the lens of marketing. It is well marketed and it brings in more
Definitely.
patients, so it's worth having.
Absolutely, yes. And I'm not one to bring something in just because it's new, but if it happens to be new and it's got chops behind it,
Yeah,
it's
exactly.
definitely going to increase your value. And you know what I've been through with some of the acne treatments that I've pioneered as
Yes.
well. You know, that helped me get out of COVID. I brought on a new acne treatment that no one else was doing called Sebacia, and we've treated so many patients with it, more than anyone else in the country. And I feel like that helped us recover from 2 3 months of being shut down. So anything new you can bring in, if it's
You,
helpful.
you should. You should always, it's
Yeah.
always worth putting the bet on being first to market, new to
Yes.
market, as long as it's something that you believe in,
Right.
right? That makes sense medically, but it's worth the risk to bring something in that's new because the reward might be worth it, like with you and Sebacia.
Definitely. I'm a big proponent of new technologies.
Yeah.
I'm evaluating a new cellulite device right now called Celluleaf. I don't know if you've heard of it
I
yet.
have not actually.
It's sort of it's reminiscent a little bit of Avili, but
I
it's
was gonna
not.
say I definitely know
Yeah,
what Avli is.
yeah,
Yeah.
it's not quite the same. It looks kind of similar, but Avili is for distinct sort of dimples in the
Dimples.
buttock.
Yeah.
The Celluleaf is a little bit more for like a diffuse cottage cheese type of cellulite.
Well, that interests me.
Yes, yeah, so it's applicable to a larger area.
Yeah.
And new company out of the Netherlands, but they're FDA approved here in America. And I did some of the first cases on the West Coast already. And so we're evaluating it really well for larger areas like lateral thigh and buttock, but very different than Avili in the sense that it's more for larger areas.
I think that's fantastic. I think Avali has had some great results for the dimples, but I think the problem they run into is people want to fix the cottage cheese cellulite. So
Yes,
the expectations are off because they think it's going to be the dimples and the cottage cheese that's going to go away, and it does not fix the cottage cheese.
it doesn't. We're hopeful that this would be an adjunct because they can actually be done together
That'd
on
be
the same
interesting.
day. So for patients that have both, we can offer
Which
both.
is what, like 95% of women or something
It's
like
true.
it's a big percentage.
Definitely, it's a common problem, and people have been asking us for treatments for decades.
Yes. Yeah. Well, that's really cool. And that is innovative. So I
Thank
love
you.
that you're doing that.
Thank you so much.
All right. Well, that's all we have. Thank you so
Thank you.
much for
Thanks for
being on
having
the
me. Really
podcast.
appreciate it. Great to see you.